Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province of New Brunswick today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour à toutes et à tous. Further to yesterday's briefing, I have some information regarding community face masks. We did get a lot of emails and questions on social media, so I'll just clarify a few of those points. Masks are now mandatory in all indoor public spaces in New Brunswick. And those public places include retail businesses and shopping centers, personal service businesses like hair salons, barbershops, spas, etc., except during services that require moving a mask, restaurants and bars, except while eating or drinking, places of worship and faith gatherings, places for cultural or entertainment activities, including movie theaters, theater performances, dance recitals, festivals, concerts, etc., places for sports and recreational activities, including gyms, yoga studios, pools, etc., except during physical activity, municipal and provincial government locations that offer services to the public, and common areas such as lobbies, elevators, and hallways. This afternoon, Public Health recommended to the government that Zone 1 and Zone 5 immediately transition back to the orange level under the province's COVID-19 recovery plan. And I know that this sounds like big news, which it is, because we haven't had to do that since Region 5 had their outbreak several months ago. So these are very serious recommendations, and so we are going ahead with that. And the recommendation around Zone 1, in terms of going to orange, it was due to additional public health exposures that were identified through the investigation of existing cases of potential community transmission being investigated, and reports of low compliance with directives in some higher risk settings. And the recommendation for Zone 5 is due to a community outbreak that involves several exposure settings, cases of potential community transmission being investigated, and reports of low compliance with directives in some higher risk settings. And Premier Higgs will share some further details around this. Today we have 13 new cases of COVID-19 to announce. There was a social media post that had a very different number than that, but I'm telling you based on the most accurate and up-to-date information, it is 13. So 12 of these cases are in Zone 5 in the Camelton region, and 1 is in Zone 1 in the Moncton region. And the new cases are an individual between 20 and 29 in Zone 5, the Camelton region. This case is travel-related. An individual between 30 and 39 in Zone 5, the Camelton region. 4 people between 40 and 49 in Zone 5, the Camelton region. An individual between 50 and 59 in Zone 5, the Camelton region. And 4 people between 60 and 69 in Zone 5, the Camelton region. An individual between 70 and 79 in Zone 5 in the Camelton region. And an individual between 40 and 49 in Zone 1 in the Moncton region. At this moment in time, there are 150 people who are self-isolating at home as a result of the Moncton outbreak related to the manoir. And before I go any further, I just want to thank the medical officers of health in the region, as well as our Deputy Chief Medical Officer of Health, who has been leading our new COVID response team at the New Brunswick Health Emergency Operations Center. So Dr. Mewick, Dr. Yves Legere, Dr. Paquette, and Dr. Barker, and Dr. Lamptey, and all the staff who are working extremely hard at this time to get these outbreaks under control. And I also want to thank the public for their cooperation, because I understand that all the contact tracing that's been happening has been going well in terms of the cooperation and how forthcoming everybody is in providing that information in a timely way. So we really want to encourage people to continue with those cooperative efforts. In relation to the Moncton outbreak, I have a new potential public exposure at the dining room of the Morton Avenue McDonald's between 8 a.m. and noon from September 28th to October 5th inclusive. So people who have visited the dining room of this restaurant during the period of time should self-monitor for symptoms for 14 days, and should any COVID-19 symptoms develop, they are directed to self-isolate and use the online form. It is the fastest way to get tested.
Today, I have 13 new cases to announce in the province. 12 of these cases are in Zone 5, the Campbellton region, and 1 is in Zone 1, the Moncton region. The new cases go as follow. An individual between 20 and 29 in Zone 5, Campbellton region. This case is related to travel. An individual between 30 and 39 in Zone 5, Campbellton region. 4 people between 40 and 49 in Zone 5, Campbellton region. An individual between 50 and 59 in Zone 5, Campbellton region. 4 people between 60 and 69 in Zone 5, Campbellton region. An individual between 70 and 79 in Zone 5, Campbellton region. An individual between 40 and 49 in Zone 1, Moncton region. These cases are all under investigation. In relation to the Moncton outbreak, I have a new potential public exposure at the dining room of the Morton Avenue McDonald's between 8 a.m. and 12 noon between September 28th to October 5th inclusively. People who have visited this restaurant during this time period should self-monitor for symptoms for 14 days. Should any COVID-19 symptoms develop, they are directed to self-isolate and use the online form. It is the fastest way to get tested.
While these new cases are not welcome, as I have said before, they are not unexpected given what we are seeing in our neighboring jurisdictions. The numbers outside our borders are really not good and continue to increase. The pandemic is not done with us, and this week has shown us that in no uncertain terms. It also has reminded us of the importance of keeping our circles small and also following all the public health measures. I decided to, as an exercise earlier in the week to keep track of who I was interacting with over the last couple of weeks, and I think there are 8 coworkers that I interact with on a very regular basis with respect to meetings, and I have about 15 family members and close friends over the last 2 weeks that I had interacted with, that if I was diagnosed with COVID-19, these would be the people that would be on my close contact list. So I think everybody has to work very, very hard at keeping their circles very, very small and keeping those close contacts low. So a close contact is somebody who you interact with for more than 15 minutes at a time, less than 6 feet apart, without wearing a mask. It
is much easier and much faster to identify contacts when there are fewer close contacts. A close contact is when you spend 15 minutes or more with a person within 6 feet without wearing a mask.
In the yellow level, you must keep your circles small, and you must continue to do what you have been doing, which is to maintain 2 meters of physical distance between yourself and others whenever you can. In public spaces, wear a mask or face covering. Always keep a couple of masks with you when you're out, and make sure to wash them regularly. And somebody pointed this out to me today, that some people actually aren't wearing them properly. So make sure that it is covering your nose, make sure it is covering your mouth, and that there aren't gaps above the mask or on the sides or below. Wash your hands regularly and thoroughly. Cough and sneeze into your sleeve, and regularly clean high contact surfaces like kitchen countertops and door handles. On their own, these individual actions aren't enough to stop COVID-19, but when done together, these actions will help us limit the spread of the virus. And also, on that note, we all do need to work together to make sure that we're all on top of this. Again, there are many people working very diligently and very hard right now to contain the outbreaks in Zone 1 and Zone 5, and we really need to all work together to help them. Prises individuellement, ces mesures
On their own, these individual actions aren't enough to stop COVID-19, but when done together, these actions will help us limit the spread of the virus.
of the people of New Brunswick. One person alone can't contain the spread of this virus. But when we all take these actions, when we all work together, we can make a difference. Another action I encourage everyone to take, if you haven't already done so, is to download the COVID Alert app. You can be assured that your information is safe and secure on this app, and it is one more tool that we can use to keep one another safe and to help speed up contact tracing. The quicker we can trace who an infected individual has been in contact with, the quicker we are able to reduce the number of possible future contacts. And I just want to bring to your attention also that during the course of these 2 outbreaks that we're managing and investigating, there have been several cases that have been asymptomatic, and there have been several cases where the only symptom was a runny nose. So even if you think you just have the common cold and just have a runny nose, please take this very seriously. We are really counting on everyone to get tested if they have any of the symptoms of COVID-19 that are on our list. Si vous vous sentez pas bien, isolez.
If you do not feel well, self-isolate and monitor your symptoms. If you have symptoms of COVID-19, either call 811 to arrange a test or fill out the online form. The online form is quick and easy to fill out, and I encourage anyone who can to use this option.
Between Saturday and Wednesday, the use of this online form jumped from 145 people to 1,000 people. So what we know is that word is getting out that this is available in terms of access to a timely way to get referred for a test. So I want to thank everyone who has chosen to use the online form, because this helps free up the space for others who need to talk to somebody at 811. And we all have a responsibility to keep one another healthy and safe. Caring for one another, our family, our friends, our neighbors, our communities, is a big part of what makes New Brunswick special, and it is a big part of why we are able to contain the spread of the virus during the first wave of the pandemic. We are working together. We are taking into account all the lessons that we have learned thus far. We are learning how to get through this so that we can get through this wave. Ensemble.
Together, we will contain the spread of the virus. Together, we will keep one another healthy and safe.
As we head into this long weekend, remember that each and every one of you has the power to do something to protect your loved ones. And, you know, I think, again, our level of attention to the details that we need to really try to comply with are very important. As you know, again, we're so connected here in New Brunswick to one another from all 4 corners of this province. And I know that we all want to protect our loved ones. And when I think about what it is that we can do and what we should do to be heroes, really, in this pandemic, I just noticed online there was a story about a 7-year-old girl in BC who saved her mom's life. She had been in a car crash, and the car left the road. It went down an embankment, and this 7-year-old girl was able to kick out one of the windows that had been cracked, climb up a 9-meter embankment, and flag down some help. And her mom was unconscious. And so she was a hero. She actually did receive an award for that. And she did that because her mom's life was in danger, and she did everything she could to save her mom's life. So I think we all have that fire in us to want to save others and protect others, and I think we can do that together as a province. So for Thanksgiving this year, again, please try to have either a virtual one or have one outdoors. If you are going to have one inside, keep it small, and please don't gather if you're not feeling well. This pandemic might feel like you are out of control, that you don't have control over the situation, but you can control the individual steps that you take to protect yourself and the people that you love. Be kind and supportive of one another, and remember that we are all doing the very best we can in a difficult situation. And again, I'm counting on all of you to be heroes and protect your loved ones. Have a good Thanksgiving weekend. Un gros merci.
Good afternoon. Bonjour. As we heard from Dr. Russell, Public Health is recommending that we move to the orange alert level in Zone 1, the Greater Moncton region, and in Zone 5, the Campbellton region, due to the increase in cases in these areas. I met with Cabinet and the All-Party Cabinet Committee on COVID-19 this afternoon, and we have made the decision to follow this advice. Effective as of midnight tonight, Zone 1 and Zone 5 will move to the orange level of the recovery. As Dr. Russell explained, this recommendation was made because of additional potential public exposures to the virus identified through the investigation of existing cases, possible community transmission, and reports of low compliance in some higher risk settings. There are currently 150 people self-isolating in the Zone 1 Moncton area in relation to the outbreak at the Manoir Notre Dame. The change to orange means that residents in these zones will need to stay within a 2-household bubble. Unlike the previous version of the orange level, this bubble can extend to include caregivers and immediate family members. Outdoor gatherings must be limited to 10 or fewer with physical distancing. Indoor religious services, weddings, and funerals are permitted with 10 people or fewer. Personal services such as barbers, hairstylists, and spas will not be permitted to operate. Les gymnases et les centres
Gymnasiums will have to cease their activities, as well as businesses and recreational centers, casinos, entertainment sectors, bingo halls, arcades, cinemas, and theaters will have to close.
Food, beverages, and retail can continue to operate under their COVID-19 operational plan. Primary care providers, as well as regulated and unregulated health professionals, can continue to provide services using virtual options whenever possible. Daycares and K-12 schools will remain open, and strict guidance with virtual learning to be used for at-risk populations. Due to the positive case that has been confirmed at Sugarloaf High School in Campbellton, the school is closed today. Staff are working on providing students with access to their belongings and anything that they may require for online learning. All students from the high school will be learning remotely on Tuesday, October 13th and Wednesday, October 14th. This will give teachers time to prepare for the transition to full-time online learning for students from Quebec, which goes into effect on Tuesday. It is not an easy choice to move any area of this province to orange, but we must all use the tools available for us to slow down the spread of this virus. If everyone follows the simple rules in place, they will protect us. I am confident we will be able to keep these cases contained and quickly flatten the curve once again. While other areas remain yellow, everyone must continue to follow public health guidelines. We are discouraging travel in and out of the 2 impacted zones, except for essential reasons. If you live in a different zone and are traveling on the Trans-Canada Highway, which passes through Greater Moncton, please do not stop at this time. Yesterday, I announced that it is mandatory to wear a mask in all public indoor spaces. That rule is in effect now in all parts of New Brunswick. I also told you yesterday that inspection and enforcement officers with the Department of Justice and Public Safety visited 600 locations in New Brunswick and found that on average, only 36% of people were wearing masks. In the days ahead, officers will once again monitor public spaces across the province to make sure people are now complying. This week, due to the outbreak, we continue to monitor mask usage in the Greater Moncton area. Officers will be visiting businesses throughout the province and checking their operational plans to make sure they are operating safely. Ces plans opérationnels ne sont pas nouveaux.
These operational plans are not new. Businesses had to prepare them when they were authorized to reopen many months ago. Having to wear a mask in public spaces is not new either.
For months, the state of emergency order has clearly stated that masks were required whenever 2 meters of physical distance from others could not be maintained. Yesterday's announcement simply made it more explicit that masks are required and they are not optional. While officers will be monitoring the situation and ensuring people understand and are following the rules, their focus at this time is on education. We have no desire to issue fines, but we do want to encourage people to change their behavior. We all have a responsibility to wear a mask to protect the people around us. Rappelez-vous.
Remember that these rules are in place to protect consumers, but also to protect employees and their families. Everyone has the right to feel safe at work, and we can all play a part to make sure that that is possible.
I will be paying close attention to the reports on compliance that I will be receiving from Justice and Public Safety in the days and weeks to come. I am optimistic, however, that we will see the number of people wearing masks improve significantly over what was observed earlier this week and last week. We are coming up to a long weekend, and I know that New Brunswickers are excited to spend time with their families and friends for Thanksgiving. With this change, however, in the alert level in 2 health zones, I have to remind everyone to respect the rules associated with their zone when making their plans.
We are lucky to live in a province where we can still get together in relatively risk-free conditions. However, it is important to respect public health guidelines and to take the necessary precautions to keep the risk levels low.
No matter where you live, keep your gatherings small this weekend and consider holding them outside if the weather permits. Remember to wash your hands frequently and stay home if you aren't feeling well. And if you do have symptoms of COVID-19, please contact Telcare 811 or your family doctor to arrange for testing. Right now, 2 health zones are in the orange level. But even if you live in a place where the alert level is yellow, this is a reminder that we all have to behave as though the virus is in our community. Même si on ne rapporte.
Even if we are not reporting any cases in your region, you must presume that COVID-19 is among us.
New Brunswickers have already shown that we're capable of flattening the curve. We did our part early in this pandemic to slow the spread of the virus, and I am confident that we can do it again. I am confident that we will help those workers that are out now diligently tracing any contacts, anyone who may have been in contact with other individuals in relation to the virus. I am confident that our health professionals will follow the rules and give the care that they always have done. We just need to do the same as citizens of this province in every aspect of what we do, in every aspect of our daily routine. We just have to be a little more cognizant of the virus and live safely within this time of COVID. So stay safe this weekend. Wear your mask whenever you are in an indoor public space and follow the rules associated with alert level in your health zone. Together, we can turn things around quickly and get all of New Brunswick back on the yellow level. Together, we will continue our recovery in New Brunswick during COVID. We can't go back. We only need to move forward, but we can only succeed at this if we do it together. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Thank you. Premier Higgs and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question, puis vous avez toujours le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have only one question. Tim Jakes, Campbellton Tribune.
Question for Dr. Russell. Do you know the source of the Zone 5 cases? Are they associated with the Zone 1 outbreak or with something else, say Quebec or travel?
The contact tracing is still ongoing for the Zone 5 outbreak. My understanding is they're not connected to the Zone 1 outbreak. And I know at least one of the cases is travel related, but I don't know if they've, they're still doing a lot of investigating. What I know right now is that at least one of the cases in Zone 5 is travel related.
Thank you, Mr. Jakes. Travis Fortnum, Global TV.
Hi there. So there was two cases in the Moncton region who are hospitalized. I was just wondering if there was an update on how those two are doing.
My understanding is that there had been recently one that came out of ICU and was stable, and they were hoping to discharge at least one of the two cases. So my understanding is they're both doing well, stable. Oh, there were 3 in total, but yes.
Thank you, Mr. Fortnum. Pascal Rochnog, L'Acadie Nouvelle.
Ma question est pour la docteure.
My question is for Dr. Russell. Can you give us an idea of the timeline for the orange phase for the Restigouche in the southwest? How long can it last, and at what frequency will you reassess the situation? What would make you revert this decision? Right now, Zone 1 and Zone 5 are in the orange phase. This will go on for as long as the outbreak lasts. Once the number of cases goes down and everything is under control, I think we can expect about 2 weeks for assessment intervals, because that's the incubation period of the virus. But as we continue our investigation and testing, it's possible that we'll find more cases in other areas. So we'll continue with the contact tracing.
CHCO TV.
Thanks, Bruce. My question is either for Dr. Russell or Premier Higgs. Across the border in Maine, there are a growing number of communities using weekly wastewater testing to detect for the presence of COVID-19 before an outbreak starts. Now that we have 2 outbreaks in New Brunswick, is this a strategy that might be reconsidered for New Brunswick? And have you reached out to any of those communities to see how they're doing it?
So at the national level, there was some research being undertaken, and my understanding is that not through the government, but through that research, there is some sewage water testing actually in Moncton that's taking place right now. I don't have any more information on that, but I am aware that it is taking place.
Thank you, Ms. Hogarth. Mia Urquhart, CBC.
Thanks, Bruce. I'm wondering how many of the new cases in Zone 5 are related to the outbreak surrounding the school.
So right now, all I can tell you is that there are different facilities involved. In Zone 5, there is a healthcare facility that has reduced its number of services that are available. There's a phlebotomy clinic that's been affected. And a school. The contact tracing is still happening, and so there are probably going to be more people being tested as a result of that. That's all the information I have right now in terms of all of those cases, and that one of them is travel related.
Thank you, Ms. Urquhart. Laura Lyle, CTV.
Thanks, Bruce. So this would be a question for either Dr. Russell or Premier Higgs. I'm just wondering, with what is happening in the Campbellton and Moncton regions, Have you or do you plan on sending extra workers to help manage the situation there?
So there's a coordination between the regional public health offices as connected to the Department of Health Emergency Operations Committee. So there are a lot of people who are working very, very diligently on these two situations concurrently. What we do is if we have to step up anything in terms of moving resources around, the regional health authorities do help us with that with respect to public health nurses, and if we need inspectors from DPS to help out, because they can sometimes do the contact tracing as well. So as of right now, we have the resources from the regions assisting with the Department of Health Emergency Operations Center. If things were to progress, there is actually more help available from Service Nouveau-Brunswick, and then at the national level, there is contact tracing help. So as of right now, everything is being managed appropriately and in a timely manner, but we would like to stay ahead of it and get this under control as quickly as possible.
Thank you, Doctor. Thank you, Ms. Lau. Bobby G. McKinnon, CBC.
Yes, hello. Questions for Dr. Russell. Earlier this week, you outlined the general advice for visitation at homes, but didn't know what was happening at Notre Dame. Was the home complying with the province's guidelines?
So long-term care facilities and adult residential facilities fall under social development, and we've been working very, very closely with social development as well as the pandemic task force to identify what were all the measures that should be in place. So all of these institutions and facilities should have operational plans to be followed. And then recently, again, we have been in communication on an ongoing basis, again, through the Emergency Operations Center in terms of preparedness and planning. So again, we set out all of the guidelines and guidance documents through the Pandemic Task Force, and then each individual operator for the privately owned facilities are supposed to operationalize that, and then through the government-owned ones, those were supposed to be operationalized as well. So that's all I can tell you about what has been happening. What actually transpired in terms of what was on the ground, I don't have much more information than that, other than Dr. Dow who's one of the infectious disease specialists in Moncton and who's also on the pandemic task force, actually did a site visit when the outbreak was first declared, and he attended that facility with an IPC nurse to really go over information for the staff, to refresh them on all the procedures and protocols. And he actually went through quite a few of the documents in terms of what could be done and should be done. And on the conversation that we had today, he was quite pleased with a lot of the things that had been happening there ahead of this outbreak. So I can't really speak to any more details than that, other than we did have, again, a site visit from Dr. Dow to that facility.
Thank you, Ms. McKinnon. François Leblanc, Radio-Canada.
François Leblanc, Radio-Canada. I have a question for Dr. Russell. I would like to have more information about sports and organized sports. You're saying that they can no longer take place. But what about Moncton's sports teams that were meant to travel for away games? There are players from Moncton's that found out that they were playing for teams in Nova Scotia. How are they affected? And does Soccer New Brunswick think that they can play sports with groups of 10 people with social distancing? I'd like more information about this.
I would suggest that at this point in time, going into Zone Orange in the Moncton region, there shouldn't be any hockey teams traveling into the region or out of the region until we have a clear understanding of where this is going, and that'll only happen over the next couple of weeks. So I would say that there's certainly wherever the communities were that they were traveling to would appreciate that the movement wouldn't be outside the zone. Those are the rules we're placing around the zones 1, zone 5, is that people really don't move outside of that zone unless it's an essential reason, and I would suggest this would not be an essential reason.
But
Merci, Monsieur Leblanc. Callum Smith.
on sait pas.
He didn't answer. Is this a recommendation or a suggestion? So saying there's nothing that can stop people from Moncton to go play in Amherst. There's no control in place, and this is what my question is.
Suggesting, and part of the zone is that you're not moving around in the outside of the zone. You're not exposing other regions within the province, and you wouldn't be following the rules around close contact and whether you're, be able to wear masks. And this is a new scenario in this region. We're not we wouldn't know the condition of the team members or if they've been contacted or traced at this time, because that's what we're going through at this point. So, whether you take it as a suggestion, a recommendation, or a new guideline, it is currently the rule that you will not be going outside of this region and exposing others in other areas. It just wouldn't make sense to do so.
Callum Smith, Global News.
Thank you, and just to sort of follow up on that, I think the Premier just clarified it, but just to confirm, so what about with the 2 household bubble for zones 1 and 5? That's still the main message is no travel there. It's not so if there was family in St. John or Fredericton, someone from zone 1 or zone 5 could not have a bubble with households in those regions. Is that correct?
That is correct. We would suggest that if there's a 2 household bubble, which a zone orange does allow, it would be within zone orange because you are unnecessarily exposing family members to do otherwise.
Thank you.
Thank you, Mr. Smith. Savannah Odd, Telegraph Journal.
Hi.
Hi.
My question is for Dr. Russell. Are you able to confirm the source of the Zone 1 outbreak? I know you said you weren't sure on Zone 5, so I'm looking for Zone 1, and as well, how many cases are being investigated as possible community exposures at this time?
Well, when we say that something's being investigated as community exposure, what it really means is that either the contact tracing hasn't been completed in terms of all the people that need to be contacted or have been contacted. It can also mean that we've contacted everybody and haven't found a travel-related source. So for the Zone 1 outbreak, we have a travel-related case that we can attribute to that outbreak. There is a new case in Zone 1 that is under investigation, so I can't comment one way or the other because we don't have enough information. With respect to Zone 5, we do have one travel-related case for sure, but not all the contacts have been traced to link them all together up there yet. So again, the jury's still out on what that situation looks like. So that is why we say there's still the potential until we have that all nailed down and confirmed.
Thank you, Ms. Odd. Eilish, CTV.
Thanks, Bruce. My question is for either Dr. Russell or Premier Higgs. Please correct me if I'm wrong, but the case at the Campbellton High School is the first confirmed case in a school in the province. So my question is, what all is being done to keep things contained within that school and also to keep it out of the rest of the schools across the province?
So with respect to that school, the closure of the school at this point in time, they are closing it to clean and also to carry out the contact tracing. So once the contact tracing has been completed and the cleaning has been done, then further actions or steps can be provided to the school community. But at this point in time, that work is underway. So that's what's going to happen for right now, and the fact that it is in zone, that it is in the orange phase as well, will affect the masking situation as well in the schools. So So the Department of Education and Early Childhood Development, they have an outbreak management plan, and that's going to be followed. And again, we're working very closely together with public health as well. And the school and the district staff will follow any advice that may be provided by public health as a result of the continued investigation and contact tracing. So everybody's privacy is being protected at this moment in time from the perspective of the students and the staff. So this is as per the Personal Health Information Privacy and Access Act. So that's pretty much all I can say about that situation, other than the Sugarloaf High School students will be learning remotely on October 14th and 15th next week, but that was planned prior to this. They're testing out their online learning procedures, and it was also as a result of allowing the staff to prepare for the transition of full-time blended learning of the high school students living in Pointe-à-la-Croix, Pointe-à-la-Croix and Listigouche communities. So, and in terms of outbreak preparedness and management, the return to school plan was developed to help protect the health and safety of students and staff by reducing the risk in schools and enable contact tracing if required. And public health is responsible for that contact tracing, the risk management, and decision making on those who self-isolate, or on those who should isolate. On who should isolate. They may choose to isolate an individual or grouping in a number of contacts, and parents should be prepared that schools may not just close because of a confirmed case. A school and district staff will follow any of the advice that is provided by public health. So that's what we're doing for the time being.
Thank you very much. Eilish. Catherine Poisson, Radio-Canada.
Catherine Poisson, Radio-Canada. My question is about the outbreak at Sugarloaf High School. Do we know of students from Pointe-à-la-Croix, Restigouche that could be affected by this outbreak? And are you in contact with the Band Council for Remote Learning and whether that would go on for months? I didn't hear your entire question, but what I understood is you want to know if the case in the school was connected to Pointe-à-la-Croix or Restigouche. You want to know if students are involved from those areas? Yes, I want to know if it affects Listigouche and Pointe-à-la-Croix, and if you've been in touch with those administrations for next steps. I really don't have any information to share on that. All I can say is there is one case in that school, and the school is closed to do contact tracing and to clean the school.
Poisson, Shane McGee, CBC.
Hi, given what's happening in these two zones, I'm sure there's thousands of parents and students wondering about the specific impacts at daycares and schools. The news release says they're open under strict guidance with virtual learning for at-risk populations. So can we get specifics? And I thought I heard a reference to masks, so just looking for more details.
Yeah, so in the orange phase, the masking is actually slightly different. From K to 8, students would have to wear masks if they were doing things that involved interacting with each other and the teacher, etc. But if it's quiet learning at their desk with no talking, then they would be able to take their masks off. High school students will be expected to wear their masks all day long. And so that's the differentiation in masking. I didn't get the other part of your question, sorry.
Just looking to get more specifics about what this will mean for education and busing at schools and daycares.
I don't have any extra information on what that looks like, but my understanding, again, in orange phase, schools will continue to be open, daycares will continue to be open, and with respect to at-risk populations, then those would be better to have online learning for them. And as I mentioned, that high school had planned to do some exclusively online learning in the high school for the 14th and 15th of October.
Thank you, Mr. McGee. Nicolas Steinbach, Radio-Canada.
Nicolas Steinbach, Radio-Canada. Hello, the question is for Dr. Russell. I wanted to confirm the community transmission aspect in Zone 1 and 5. Have you seen community transmission yet? And you also talked about 150 people who are self-isolating in Moncton. Do we know how many people are self-isolating in Zone 5? 150 is the number of people that are self-isolating at home now related to the outbreak at Manoir Notre-Dame. With regards to community transmission, we are not yet done doing contact tracing because there is a new case in Zone 5. We are not done tracing that case, so we don't know if it's associated to travel or community transmission. But in the manner, we can say that it was associated to travel. With regard to Campbellton, one case in Zone 5, one case is associated to travel, but we still need to do contact tracing for the others to see if there was community transmission or not. So you're saying it's too soon, and you didn't answer how many people are self-isolating in Zone 5. I don't have that number yet. We can get it to you, though.
Journal.
So my question's for Dr. Russell. Dr. Russell, a bit of a two-parter here. First of all...
That's not fair.
Who's exempt on the masks? Because I think there's a lot of confusion about what medical conditions would constitute an exemption. And what about kids that live in one of these zones but go to school in a different one? Are they still allowed to go?
My understanding is yes for the schools. If you're in one zone, you can go to school in the other zone. That EECD is working with us on making sure that that's doable, and they do have a policy on that, actually. And what was the other question that you snuck in?
Exactly what constitutes a medical exemption? Just tell me what that is.
Yeah, we're trying not to be too picky about that in the sense that, we're trying to take people at face value and kind of an honor system in the sense that we're not going to challenge that. So we just want people to understand that we are using the approach that Nova Scotia has taken, where it's more an issue around education and support. But we don't really want people to have to go to their family doctors to get exemptions, et cetera. So it's really what we're saying is a medical problem, a medical condition, which includes mental health conditions, skin conditions, neurological conditions, and some cognitive conditions, obviously. So I think that list is probably somewhere on our website, actually, and maybe Bruce can follow up with you to make sure that you have all those details.
Doctor, you have the list over there. Stand by.
Okay.
Andrew?
Speaking.
Okay. So, masks, the exemptions. Examples of people not required to wear masks include children under the age of 2, people with a medical condition including a mental health disorder that prevents them from wearing a mask, situations that include a person who is deaf or hard of hearing, who relies on lip reading, clear sound, or facial expressions to communicate, a performer or officiant who is performing activities that require vocalization like talking or singing at a faith gathering, wedding, funeral, social event, or arts and culture event, people who are receiving medical treatment or receiving a service that requires it to be removed. In these cases, they may remove their mask for the duration of the treatment or service only. As per WorkSafe New Brunswick's guidance, face masks do not have to be worn where physical barriers are in place that protect people from potential exposure. For example, a plexiglass barrier. Workers for whom wearing a face mask would introduce a risk to the worker's health and safety related to their work environment may use a face shield as a substitute to the face covering, and there is, again, more information on the website. So what's the most important thing really is that people exempted from wearing a mask practice physical distancing and staying 2 meters away from others. And these, again, all of these details are going to be online shortly, Andrew. Wash your hands, sanitize your hands frequently, get tested if you're unwell, even with mild symptoms. It's also recommended that people exempted from wearing a mask avoid as much as possible crowded places and plan to do errands during off-peak times when stores are less crowded or have items delivered if possible.
Thank you, Mr. Waugh. Michel Corriveau, Radio-Canada.
Michel Corriveau, Radio-Canada. My question is for Dr. Russell. With everything that's happening, I would like to know if there would be change in regulations for New Brunswickers who work outside of the province. I'm not talking about essential workers. Will there be any changes on that front? You know, Michelle, that's a very good question. We're trying to see everything we can do to protect New Brunswickers. We want to stay in the yellow phase as much as possible. We're going to discuss and take decisions on this next week, I hope. And like you said, there are several categories of workers that have to leave the province to work and they come back. And there are also people who come into the province to work. For those who come into the province to work, there is an isolation plan. This was developed with WorkSafe New Brunswick. This has been in place since the start of the pandemic. Essential workers who come and go regularly already have rules in place. But we're going to see how we can make it a little bit more safe. Maybe we'll include other things like regular testing to reduce risks for people who work in other provinces.
Voilà la fin de notre mise à jour pour ce vendredi. Merci beaucoup. That concludes today's update. Thank you very much.